Okay, it's my great pleasure today then to welcome Eunice and Ridwan to the BIDM. As I say, they work for the Wellbeing Foundation in Africa, an organisation who we have had on the VIDM before. So it's our delight to welcome you both. Eunice is a dedicated nurse midwife for over 15 years, who is working now as a digital midwife since 2015. And Ridwan is a data specialist with over 5 years experience in public health and social impact programs. And any more introduction to that, Eunice and Ridwan can give for themselves. So over to you. Thank you.
Okay, thank you so much, Linda, and thank you, Ridwan, for joining us here. Thank you for having us here. Okay, so today, like Ellen mentioned, we're going to be having a presentation on neonatal jaundice and NICU care prevention, management, and the impact of maids on healthcare seeking behavior. We would want to give an introduction into our presentation. So we'll be looking at introduction, the background, literature review, the purpose of the study, justification for the study area, methods, results, findings, recommendations, future directions, call to action, and of course, we're going to have the references. So we want to talk about neonatal jaundice. What is neonatal jaundice? We've had a lot of definition, a lot of explanation to what neonatal jaundice is, but if we're to give it the formal introduction, what it is, what is neonatal jaundice? It is a common but potentially severe condition caused by elevated bilirubin levels, leading to yellowish discoloration of the skin and the sclera. So if there is, once the baby is delivered and there is any challenge with, of course, we have breakdown of red blood cells. One of the byproducts of the breakdown of red blood cells is the bilirubin. Now, if there is accumulation of this bilirubin in the bloodstream, raised beyond the normal level, it's going to find its way into the tissue spaces, into the skin, and then the white part of the eye, which is called the sclera. And one way we'll discover, we'll be able to identify that, oh, this is jaundice, is that yellowish discoloration. So that is just a brief explanation of what that definition is. Of course, if jaundice is not treated properly, or not treated at all, it can lead to a very severe irreversible neurological condition, which is known as kernicterus. And this can cause a lifelong disability or could even end up in death, which is why this presentation is to educate as many as we can on what neonatal jaundice is and the complication or the implication if not managed, if not identified early and managed as appropriate as it should be. So despite the advances, of course, we've seen different technological advances, advancements in medicine, in clinical practice. We've seen a lot of improvements, a lot of evolvement that has occurred. Regardless of all of this, in the face of all of this, neonatal care, many people still have myths and misconceptions with regards to neonatal jaundice, how it should, the approach they should give to it in ensuring early treatment, early management, and also bringing every care that should come to it. This presentation explores the impact of cultural beliefs on neonatal jaundice. Now, remember, we said the topic has to that, a lot about neonatal jaundice, care, treatment, and management, and the impacts of myths and misconceptions on health-seeking behavior. So this presentation is to help us explore the impact of cultural beliefs in neonatal jaundice, the management, and also the health-seeking behavior of individuals, emphasizing the need for community education. One way to empower people is to educate them and how midwife-led interventions can improve outcomes. Of course, we need the midwives, those that are at the forefront of delivering healthcare, of ensuring that mothers, families get this information to be able to take the appropriate approach to manage neonatal jaundice and to prevent the complication which we don't want to occur. Now, what are the causes of neonatal jaundice? We've talked about the different, or the definition itself. So what are the causes? Like I said earlier on, when defining neonatal jaundice, it is caused by elevated bilirubin level when it is raised, or of course, during one, there is red cell breakdown. Once there is excessive breakdown of red blood cells, there is elevated bilirubin level in the bloodstream. And this bilirubin find its way into the tissue spaces, into the skin, underneath the skin, and into the white part of the eye, the sclera. So while often physiological jaundice is harmless, at this point I want to say, of course, there are two major types, the physiological and the pathological jaundice. Physiological is harmless. It's more or less like, okay, because after the baby is delivered, there is excess blood, which the baby may not use after delivery, and so it needs to be broken down. But remember, the liver is not matured enough to process that unconjugated bilirubin to a conjugated one, which is water soluble, that can be excreted in bile. Now, regardless of this challenge of how much physiological jaundice is harmless, it can stem from various underlying conditions, including immature liver function, like I said, and then prematurity. The baby is not up to time, is delivered before time. Then the blood type, remember ABO incompatibilities, and in the presence of infection that might affect even the liver, making it, of course, the liver itself is immature at that level, and then there is presence of infection. It's going to cause more harm and more disability to that liver, making it not be able to perform its function. Now we want to look at the burden of neonatal jaundice in underserved communities, because these are the people, the set of people that really have this challenge with neonatal jaundice and the incidence of increase of neonatal jaundice in that part of the community. So globally, neonatal jaundice affects approximately 60% of term and 80% of preterm newborns. NNJ is a significant yet often challenge or problem that is being affected, that is affecting the individuals or community every now and then. So we also want to look at background study. Want to look at the background of our study. Can we move to background of study, please? Thank you. Yes. I've talked about the burden of NNJ in underserved communities. As significant as it is, yes, it's often overlooked by people in that community. After over 1 million newborns annually, wonderful, it remains one of the leading causes of neonatal hospitalization and long-term disabilities and mortality. Remember, I said to us the other time that NNJ has a way of, causing challenges in the individual. Apart from the fact that it brings the complication of kernicterus, there is that complication of death too, which is something that is to the extreme. Now, despite the availability of effective interventions, involvement of technologies and approaches to managing NNJ, yet there is gaps in knowledge, attitude, and practices regarding neonatal jaundice, which makes it to persist among healthcare providers and caregivers. So this gap in knowledge is one part that we're going to handle in this presentation. How do we bridge this gap? It's very, very important. Also, furthermore, misconceptions surrounding the causes, prevention, and treatment of neonatal jaundice hinders timely and appropriate medical intervention. Consequences of delayed treatment, we can't overemphasize that. The consequence of delayed treatment of neonatal jaundice can be severe. We've talked about kernicterus, which is a life-threatening condition, and it can evolve from there, stem from that, and get even to death. Increased brain damage, leading to cerebral palsy, disability, including hearing loss, seizure disorder, and so on, as we can explain. So it is very important that we take adequate step as it is for us to manage neonatal jaundice, early identification, and as much as possible, it is very important we move with the speed of light to ensure that we don't have complications as much as we can manage them. So next slide, please. Thank you. So a lot of literatures were reviewed in the course of preparing for this presentation, because we realized that, like we said earlier on, the myths of misconception has been affecting health-seeking behavior. So we wanted to find out actually what are those hindrances? What are those things that have been written before now? What are those research that have been done before now with regards to neonatal jaundice, with regards to education out there, the enlightenment, the midwife intervention, the technologies that are available to identifying and managing neonatal jaundice. So in the course of our literature review, we realized that neonatal jaundice affects 60% of term and 80% of preterm infants globally, according to Bresso et al. 2016. In Nigeria, we've realized that delayed treatment is linked to poor caregiver knowledge and cultural beliefs, majorly cultural beliefs. And because of their beliefs, they find it very difficult, or they delay in seeking for help when this challenge comes up, when this condition comes up in children. So studies also reveal inadequate training among healthcare workers and lack of clear protocols, which should be taken promptly to ensure that the complication with regards to neonatal jaundice does not come up. There are cultural myths, a lot of it that we've realized. Up until yesterday, I was still talking, trying to do a community sampling, and I spoke with some mothers, and I could still hear them say things like some funny kind of approach, community approach or cultural approach to management of neonatal jaundice. And I'm like, why should that come up at all? With all this involvement, with all this education, which means there is more to do. So cultural beliefs such as jaundice being a spiritual condition. They said it's not something that has to do with health, and then they need to manage all of that culturally, which is not true because it's not evidence-based. The midwife-led intervention improves early detection and referral. Next slide, please. So to investigate the cultural myths and misconceptions that delays care-seeking behavior was one of the purposes for this study. Very, very important. Also, to identify barriers to timely diagnosis and treatment. Again, to explore the role of midwives. Remember, they are the frontliners. They are those that they are the first and the last with delivery and healthcare of mothers and children. So to explore the role of the midwife in education and referral, the earlier we refer, the better. So at this point, I'm going to allow my colleague to take up the next slide from here. Thank you. Over to you, Ridwan.
Okay, all right, thank you. So the justification for this study, which is the rationale behind us, conducting the study, the high burden of energy-related, complication, despite existing, treatment or intervention, persistence in cultural belief and misconception that hinder early seeking behavior, limited community focused research in the area of neonatal jaundice prevention and treatment. In Lagos, critical need to integrate midwives into cultural sensitive education and referral strategy is also one of the justification, and also data to inform scale up of intervention of neonatal jaundice. So, and the area of study is actually in Lagos, Nigeria, and the local government area where this study was carried out, Lagos Island, Surulere. I was carried out, in Lagos Island was part of it because, it consists of, majorly is an urban settings, and also consists of the tertiary health center, which is majorly the referral center to treat jaundice, and we also have a Surulere, which is moderately and densely, populated area, and that have access to NICU treatment in terms of the healthcare service provision, and Alimosho, which is the most populous local government area in Lagos State with the most underserved population. And also Ikeja local government, which hosts secondary and tertiary facility, which serve as referral centers for treating neonatal jaundice study area. And in this study, The methodology being used is considered as the mis-studied approach for conducting this research, and the study area were selected. I mean, the geographical area, a mix of urban and semi-urban characteristics with varying, health care facility level, which is the primary, secondary, and tertiary. And the quantitative study that was conducted was done in two areas, which is among the health worker, which are the health care provider, which involves the nurses, midwives, and doctors, and also at the community level, whereby community caregivers, mothers were also interviewed in using interview administered questionnaire to elicit some information, which is also corroborated with focus group discussion, which is conducted among the community people to also elicit more information to corroborate the quantitative study. And in course of this study, desk review were done across health facility where the study was carried out, which is across 16 healthcare facility, which include primary, secondary, and tertiary healthcare facility. And in the course of this review, we were only able to, find data on the neonatal jaundice cases and treatment in only 8 out of the 16 healthcare facility, which is, those that have documentation on this, and which is for a period of 1 year, and 492 cases were reviewed in those 8 healthcare facilities, and out of this, 85% of them were treated in those facilities. So, and the result of the findings, which shows the percentage of caregiver believing in some myths and misconception, we have only 34% that understand that medical condition in medical treatment, which is hospital-based in terms of assessing care for jaundice, care and treatment for jaundice. There is only 34% of these respondents, I mean, among the community that believes that medical intervention can be seek to treat or manage jaundice in community, while 42% of them had no knowledge at all on what to do, in terms of when they think their newborn has jaundice. And we believe that this is coming up as a result of the fact that most of them hardly even access care, do booking on during antenatal to even access care in various facilities to even have the right knowledge. And also, for most of them, they seek healthcare at at their community, which will not make them to have proper knowledge on how to treat jaundice. And 7% of them believe that sunlight exposure could help treat or manage jaundice in the while conducting this research, both at the quantitative level and also the qualitative level while we are conducting the the focus group discussion. And 15% believe that herbal treatment, medical remedies, such as using bathing the baby with some herbs, onions, bitter leaves, and other local method would help them to treat and care for jaundice, and not having it in mind that without them seeking medical condition, medical intervention, jaundice cannot be treated. So, and other findings and impact of mint, we notice that time in seeking timeliness in seeking health health care will help a whole lot to help avert the impact of jaundice, which could result to disabilities and as much as also causing death or mortality. In this study, we were able to find out that only 81% of the respondents will assess medical intervention immediately if they notice any signs and symptoms of jaundice in their babies when they actually find out. Only 81% of them, and only 60% of them believe that if the baby shows severe signs, that is when they have to seek medical intervention. And 3.6% of them will seek medical intervention after those symptoms they see them persisted, and not knowing that taking this persistence of the symptoms could cause an irreversible impact on the child, which may have some impact, a life-threatening impact that could hinder the development of that child throughout life, and as more both financial and economic burden on the parents at the end of the day. And 9.5% were uncertain about this, and we believe this could happen for the fact that awareness in the community is very low. For some of them, lack access to to healthcare facility where they can seek the right medical intervention. So, and as a result of that, those that are uncertain to will definitely still not seek medical intervention. They will result into believing in those myths and misconception of believing exposing baby to sunlight could have helped them cure the child out of this, or it is as a result of spiritual cause. And proportion of severe case due to delayed treatment, as we all say, during our the desk review that we did in the course of carrying out the survey, we noticed that out of the cases found, it was just only 85% were treated. So the 15% here, was as a result of delay in treatment. We can see that we don't even have access to some data, because some facility hardly even report some of those things, which we believe that access to more data could have helped to raise more awareness and let people know the impact of what this can cause, because the impact of jaundice, such as death or disability, would have been averted if they have the right knowledge to know that severe cases, delay in seeking healthcare behavior could result to severe cases. And 63% of the respondents acknowledge the fact that untreated neonatal jaundice could lead to death if not well if not well managed as a when due. If it doesn't result to disability, which is the common one, is cerebral palsy, and it could also lead to death at the end of the day. Thank you. So my colleague will continue with the recommendation.
Thank you so much, Ridwan, for that. So at this point, we want to look at what is the way forward. How do we want to move ahead from where we are, from the spot where we are? So we're recommending expand access to treatments, and this will involve strengthening referral systems, increase phototherapy availability, expanding neonatal intensive care support in rural and underserved areas. These are the people or the community where this myth and misconception is really, really interfering with the health-seeking behavior of those living in that community. Also, so there is also stakeholders collaboration. It's not something that a particular sector can just do alone, because we're talking about a community, we're talking about, and it is a community that makes up the state, that makes up the country. So we're talking about a large number of people. So there is need for stakeholders collaboration, engaging healthcare providers, government, NGOs, and caregivers for policy advocacy. This is very, very important. Then leveraging on technology, the use of mobile health apps. Like in the Wellbeing Foundation Africa, we have what we call the Mama Care WhatsApp platform. Now, what we do at this platform is we reach out. It's one of those mobile health area that we reach out to mothers. We educate mothers. We disseminate information that has to do with maternal health care, neonatal health care, child well-being, and that, of course, by extension, is going to extend to the family. So this use of mobile health apps and diagnostic tools for early detection and intervention is very, very important. Community awareness and education, we can't overemphasize that. So the essence of this is to dispel all the myths and misconceptions through cultural relevance campaigns and engage community leaders. You can't just get into the community and then start talking. We need to reach out to those leaders that the community members are going to listen to. When we come through the leaders, we'll be able to disseminate this information as fast and quick as possible. And also, it's going to make the community members accept, once they know that their leaders are in support of what we're bringing in. So it's going to promote cooperation, is going to promote acceptance of the message we're preaching. So healthcare workers training too, we can't take that out, because if science is evolving, technology is evolving, there are a lot of new things that are coming up, research is ongoing, and new advancements with regards to technology and healthcare practice and healthcare giving provision is coming up. So at this point, we have to keep training the capacity of healthcare workers so that they're able to deliver evidence-based and on-the-spot education to mothers, so as to be able to navigate through managing neonatal jaundice and dealing with the myths and misconceptions, so that mothers can have their early intervention as quick as possible. Then improve data and documentation. If we don't have data, how do we know the way forward? If we don't know where we are, how do we move? So it is important that we have improved data and documentation. And in the health circle, it is said, what is not written is not done. You've done it, but it's not written. So how do we validate what has been done? Documentation is very important. Then standardized reporting, training healthcare workers, and implementing electronic health records. These are very, very important in our recommendation. These are part of our recommendation. So what are the future directions? We want this recommendation to translate into a long-term impact, because we know jaundice did not just start today. We also know that it is not something that is going to go as in today, right on the spot. So we're not looking at combating it today and just leaving it at that spot. We want to move forward. We want, in the long time, what impact do we want to have in our community? So strengthening midwifery-led neonatal intervention is one very important point we're looking at. Then we're investing in training and resource allocation, expand public awareness campaign as much as we can, use every medium that we can to reach the public. It could be the media, social media platforms, like I mentioned, the WFA, that's Wellbeing Foundation Africa WhatsApp platform. We're reaching a whole lot of community. We form community of mothers, and mothers now supporting mothers, reaching out to other mothers, their friends, their colleagues, their family members, sisters, and all of that, bringing them into the community to come and hear this message on how to live well as mothers, and also to ensure the well-being of their neonates and children at large. So enhance collaboration between healthcare facilities. So this is going to improve referral. Once there is collaboration between healthcare facilities, this is not just about bringing stakeholders, but healthcare facilities within the healthcare practice. There should be referral, and there should be easy referral pathways for seamless NNJ management. So there won't be struggle with, if we send this child, we identify at this point that this baby, this neonate has jaundice, and we don't have the capacity to handle this condition. the next level of care we are referring this child to, there should be seamless referral practice, improved referral. So it just goes straight to that next level, and then management is put in place immediately. Then scale up NICU capacity. We can't take out when we have cases of prematurity or even the jaundice, neonatal jaundice itself, there is need for NICU care. So every technology that is needed to manage neonatal jaundice at that level, at the NICU level, it should be on ground. So the government should do all that they need to do, and donor investment in neonatal care that we cannot take out of our future direction is very important. Next slide, please. So at this point, we are coming to conclusion of this presentation. So what are we talking about? What have we been talking about for the past few minutes? We're saying we're addressing the myths and misconception with regards to neonatal jaundice through midwife-led education, professional, expert-led education, and advocacy is key to doing this. It is very important. The advocacy campaign, we can't take that out. Reducing neonatal complication, neonatal jaundice complication. We need to do that as fast as possible because we don't want a situation where the baby is going to come down with lifelong complication that cannot be managed. At that point, there is nothing we can do because the harm has been done already. So we don't want it to get to that level. Neonatal jaundice, of course, it can be managed. Once it's detected early, management should take up immediately. Then integrating community engagement with NICU care can significantly, of course, undoubtedly, it can significantly improve neonatal outcomes, for sure. Then there is also the support for neonatal jaundice awareness and treatment effort through policy change, resource allocation, and partnership. Policy change, resource allocation, where it should go, how it should be used, how early it should be, put into practice, put into play, and partnership. We need everybody, all hands should be on deck, all stakeholders should be on deck to ensure that this condition is managed as soon as it is identified. First, it should be identified as early as possible, and at the same time, prompt management to prevent complication. We don't want kernicterus, we don't want cerebral palsy, we don't want that condition, that state where the child cannot be helped again. No, we don't want that situation. And neither do we want it to get to the point of mortality. So at this point, I want to say thank you for listening to us. And I think that's my next slide. My references, and thank you. Appreciate you all for listening. Thank you.
Thank you. Thank you both. There are a few interesting questions in the chat, so we'll move to those. But if anybody wants to actually ask a question, please put your hand up and I will let you. But Celine has asked the question that I had in my mind, really, which is linked to other ones. Do we need to treat jaundice at all? And other people are saying, what measurement do you have? What level of jaundice do you consider needs to be treated? And I think those go nicely together.
Okay, so if I will take that question, do we need to treat jaundice at all? Of course, that's why we're having this presentation. It needs to be treated. Once it is identified, it must be treated. The first call is to quickly take that child to the healthcare facility where they have the technology, they have everything, the equipment, the resources to be able to manage that. We don't want it to get to that complication. We don't want it to get to that level. So once it is identified, early identification is very important. Once it is identified, straight up, we should take that child, whether it's physiological jaundice or it's pathological jaundice, both should be treated promptly, as prompt as we can.
Okay, that means an awful lot of babies will end up being treated. Because did you not say that there was a high number of them have jaundice?
Yes, of course there is, but then we don't want, like I said earlier on, we don't want these children to get to that level of pathological jaundice, because if you remember during my introduction, I said the physiological jaundice, as harmless as it is, can tend to pathological jaundice if not treated promptly, if not addressed promptly. So it is important we take the baby to the facility. At least let the test be done first. Let's see the level of the bilirubin. At that point, we can tell. But we also know that the breast milk can do a lot of help. giving the baby breast milk can help a lot. But mothers, we are looking at underserved communities. These mothers, they have this information. So the first thing is, once it is identified, straight to the healthcare facility. If there is need for that intense of treatment, they will be told at the healthcare facility that this is a level and it needs to be treated. Then if it is just the breast milk that is going to help, they will be told at that point also that breast milk will take care of that, and that child can be taken home.
Okay, I think that was the bit that was missing really, is that there is then measurement and determination at that point.
Okay.
So
Right.
here's another really interesting question. Have you noticed a connection between late cord clamping and jaundice? In my practice in Estonia, where late cord clamping is normal practice, cases of jaundice are very rare.
Very true. That's actually very true. Late cutting of the cord after delivery, you allow a little delay before you cut the cord. In the cases where they just cut the cord, immediately the baby is out, just cut the cord, separates the baby from the mother. We've seen cases of such where babies come down with jaundice. Most of those babies come down, but when there is late cutting, because it allows enough blood to get to the baby, and then it also allows the breakdown of red blood cells is not excessive as it is in those babies where there is early cutting of the cord. It's not excessive, so it takes a while for those for erythropoiesis to occur. Breakdown of red blood cells, it takes a while, but in late cutting is very rare, and most of the time we look at it and we want to find out what's the rationale behind the late cutting, the connection between late cutting of the cord and reduce incidence of jaundice. We want to find out why is it like that. So this is another research we're going to look at, but then at this level, yes, we've discovered that late cutting of the cord can also, children that have, or babies that their cord was delayed before cutting, of course, they don't come down with jaundice. And that is a very beautiful practice.
So do you practice late cord clamping in Nigeria?
Yes, we do. Yes, we do.
Okay, and is late cord clamping, is this just a couple of minutes, or can it be half an hour, or could it be 3 hours?
Yeah, true.
How long would you do it for?
Normally in the healthcare practice, you just give like a minute or two, and then the wait, and that is done. Late clamping is done.
Okay, because in some areas we consider that not to be late cord clamping, because that's only a minute is not really very long, but 10 minutes would be more realistic.
But most of the time they look at it from the angle of the mother, the well-being of the mother. If the mother is strong enough at that point, especially in cases of cesarean section, they want to look at the community, the state of the mother at that point, actually. That's what, at that point, the midwife or the doctor that is taking that delivery want to look at the well-being of the mother to determine how long. But of course, there is a standard. They want to look at how long should they leave this baby, delay this cord before clamping and cutting and separating it from the mother. Yeah,
that's perfectly reasonable, of course. Someone else has commented that in their area, late cord clamping means waiting until the cord stops pulsating. But obviously, mother's condition is key. I think you've answered this other question that I see here in the chat, which is, what is the recommendation about breastfeeding for a baby with jaundice? You mentioned that one of the treatments is breastfeeding, but if someone is considered to have severe jaundice, what's the position with breastfeeding then?
Okay, of course, if the mother can breastfeed direct on the breast, is allowed, and that would also be determined by the state of that baby. If the baby is in a NICU unit, expression is done, and then the baby is fed with the cup, or with nasogastric tube. But if the baby can feed on the breast, of course, the mother is allowed to breastfeed the baby. We cannot take out the very importance of the breast milk, especially the colostrum, the first milk that comes out after delivery. We can't take out the very importance and the essence of it in the well-being of that child.
Absolutely spot on. Yes, I couldn't agree more. Okay, I think that's all the questions I've seen in the chat. Does anybody else have a burning desire to ask a question? We're really running out of time anyway, so do you have any last messages you wish to give, either Ridwan or Eunice? No? Well, it just leaves me to thank you both then for a really good presentation, and has got us all discussing the merits of cord clamping as well as jaundice.
Yeah.
And we applaud the amazing work that the Wellbeing Foundation in Africa does as well. So pleased that you came to see us today, speak to us today.